Welcome back, Sweden, to your Caribou Data Science channel. And also welcome to the Dave's Data Analytics Twitch live stream on Twitch. I'll just say before we get started, Sweden, if you click on the description below in the video, you'll see a link to my Twitch channel. Click on that Twitch link, come out here and join the fun of the live screencast for our programming language, Tabula, and data visualization on Twitch. Right now, I'm currently doing 2 streams a day, one at 2 p.m., another at 8. The 2 p.m. is, as you see right now, is the daily COVID-19 analysis, plus a couple other things. The 8 p.m. one is a more general R programming / Tabula / Tidyverse data analytics sessions. I just pick some data I have or I like, and I try to do some basic data visualizations on it, and just to help us understand the world around us a little better. Okay, again, that's click on that link in the description. Come in and join the fun on Twitch with Dave's Data Analytics channel. Okay, thanks so much. That's second thing, Sweden. I had a comment here from one of my fans. I guess it's a fan. We have been told in Sweden that masks help, but more than helping, it creates a false sense of security. Okay? But if it helps, then what's the problem? Okay, as long as it helps, nothing else matters, right? If someone uses a mask but used it in the wrong way, that gives a false sense of security for everyone. Since we already social distancing, the mask is somewhat useless. With this said, I hate the people to be looking at Sweden and go, look at them, no mask, etc., etc. Why don't the government, blah, blah, blah. That was just another rant. Comments? Let's see, Sweden. That's a real question. The other problem with those things is Sweden really isn't doing that bad. If we cut through the Tuesday spikes, okay, and look at the underlying trend, your numbers really aren't doing that bad. Okay, you're doing a much better job in probably similar countries of the same size. Okay, and as far as masks, if they help at all, then why not wear them? Okay, but also, I also think they are what we may call in this country as a security blanket. And the reason is, people in America, we want to know that the sacrifices we are making is actually making a difference. Okay, that's really the thing. Unfortunately, the news media in America isn't doing that. The message of the news media is it's not working. Masks. Even though they Trump masks, the fact of the matter is the basic media from the news and liberal media is COVID-19 is getting worse and not better. So we need more crackdowns. We need more shutdowns because it's not working. Okay. The other thing to keep in mind about COVID-19 vaccines is, at least the ones in America, they're not designed to keep you from getting COVID-19. They're designed to reduce, notice I said reduce, the chances that you will die from COVID-19. You can still get vaccine and you can still die from COVID-19. Of course, the question is anybody tracking that information? Is anybody tracking the number of cases and deaths among people who have been vaccinated? My guess is probably not. Hopefully I'm wrong, but probably not. But anyway, sorry for the rant. Again, Again, by the way, that's one more time. If you like this video, be sure to go in the description, click on the link for my Twitch channel, follow Dave's Data Annex and get Cured with Data Science on Twitch. 2 streams a day, 2 p.m. and 8 p.m. But anyway, again, remember how we're looking at the data. Now, back to Sweden now. Remember how we look at the data. Sweden, as you'll see, there's a huge spike in data on Tuesdays. That's because Sweden is only recording data Tuesday to Friday. So that means Tuesday's numbers include Saturday, Sunday, Monday, and Tuesday's numbers, which produces an artificial spike. And if you didn't realize what was going on, you would think, oh my gosh, this is terrible. You know what? And I guarantee you, there's people outside of Sweden who don't realize that. Okay, they think that the people outside of Sweden look at your numbers and they think they're looking at daily numbers. But you're not. You're not looking at that. They're looking at Saturday, Sunday, Monday's numbers beginning on Tuesday. Okay, this is why we're using what's called a fitted curve. The model for this report is that trend is our friend. We cannot determine the correct daily numbers for Monday through Saturday, for the 7 days a week. Okay, so all we can look at is what the numbers are doing. Are the numbers trending up or are they trending down? Let's just go and take a look here, Sweden. One of the things, Sweden, we're currently at 191 subscribers. Our goal is 300 subscribers by Sunday evening. So we need 9 more subscribers to our channel. Okay. When it's talking about the volatility, these spikes here are Tuesday. So you got spikes on Tuesday, then it drops back down. Okay. Now, while this spike here is lower, it's still a spike. Okay, but the numbers are actually down here, not up here. So that tells you how the spike is exaggerating your numbers. And again, remember the trend is a trend. Well, here is the trend for cases. We're not concerned actually about the X value, about the Y values anymore. We're only concerned about the trend line. And you can see back up here, 1, 2, 3, 4, 5, maybe 6 weeks in a row now, we have seen some increase in COVID-19 cases in Sweden. But what this is a 28-day moving average, which means that each column is the average for the previous 28 days. So for the 28-day period ending August the 3rd, you were averaging 598 deaths or cases per day, Sweden. Okay. Now you can see here how really gnarly this data here looks. Again, the spikes for Tuesdays. But look what your trend is. The actual trend is all the way down to here. Okay, don't be misled by these spikes up here. Just look at the blue line and look how far your deaths have come. Okay, that's what I want you to focus on. In the U.S., Washington University says the single best measure of the spread of a pandemic is daily deaths, not cases and not hospital beds. So don't be misled. Okay. So now we have the 28-day moving average for deaths. So for the 28-day period ending August the 3rd, you were only averaging 1.4 deaths per day. Again, you're not going to see that if all you do is look at the raw data. Now we got weekly cases, but even so, look where you've come from. Yeah, you got a bit of a spike here, maybe up to 5,000, but then it's dropping back down. But look at where you came from. Okay, Sweden, look at where you came from. A high of over 50,000 deaths to maybe like 5,000 deaths last week. Okay? Give yourself a pat on the back. Whatever you're doing is working. But the thing to keep in mind is one sobering fact we have to be prepared for. And that's that COVID-19 may never go away. Okay? It may never go away. Now let's look at deaths. Again, look at where you've come from. Okay. We look at this spike or this spike, look at where you are right now. This number here is about 125 deaths per week. So this here is about 75 deaths. So you're somewhere between 50 and 75 deaths per week now. Down from over, well, what is this? Maybe 800 deaths for a single week up here. All right. Give yourself a pat on the back. Whatever you're doing is working. But the higher vaccination rate help? Probably. Does masks help? Does mask help? Probably some. Does social distancing help? Yeah, probably does. But anyway, before I let you go, Sweden, again, thanks so much for the people who did view this video yesterday. Thank you so much. Also, don't forget to click on that subscribe. We're currently at 291 subscribers. Our goal is 300 subscribers by Sunday evening. So be sure to click that subscribe button and click that share button. Share this video and this channel on Facebook and Twitter today. You can also copy and paste the link to this video into an email or text message. Also, click on that subscription and click on that link to Twitch. Come and join in the fun on Dave's Data Analytics screencast on Twitch today, okay? Thanks so much for your time, Sweden. We'll catch you tomorrow with an update report.